Well, the thyroid's a funny thing. There are a lot of people, and probably one of the most common things we hear. People, they have every thyroid symptom in the book. I mean, it reads like a textbook. They go get their thyroid tested,
Yeah, traditionally.
and it comes back normal,
Yeah.
right? The doctor reads the results, and it's like, well, your thyroid's normal, and it's like, man, how can it be normal when you have every symptom? And the problem with that is that the thyroid is viewed in traditional medicine as an organ unto itself.
Yeah.
Let
And
me
it's
tell
not.
you, the thyroid is a puppet. The thyroid is controlled by the hypothalamus and the pituitary. So, I mean, if management has a problem, the thyroid's going to be affected, even though the thyroid might be functioning quote unquote normally, right? There are a lot of things that can affect the thyroid that have nothing to do with the thyroid. For example, estrogen dominance.
Yes, we see that a lot. I mean, if your estrogen is high, it always means that the progesterone. See, for a woman to feel good, she needs a balance between estrogen and progesterone. So when if that gets out of whack, and especially the estrogen gets up here, then it knocks the thyroid out, and they'll get symptoms. They're cold all the time, cold hands, cold feet. They start maybe even losing some hair. You look at their eyebrows,
Yeah,
and they
thinner
lose
on
the
the
edge of
outside.
they thinner on the outside. They're lethargic. They don't feel good, and the doctor said, "Hey, your thyroid's all right. It's normal." Well, no, it's not. It's not functioning the way it should.
So we developed a supplement specifically to deal with thyroid issues.
Yeah.
We would also encourage you that if you're having issues with the thyroid, go over and get our biomarker testing done, because we'll look at a lot of other things that may be controlling the thyroid as well that might be affecting it. But our thyroid supplement was kind of constructed not only to help the thyroid, but also to help the things that control the thyroid as well.
Yeah. And it's very effective. You notice the difference. And you know what? I even have patients, for example, that are on thyroid medication. This is completely safe to add on to it, especially those who are getting symptoms still of, usually a low functioning thyroid, like what we call functional hypo, okay, which is low thyroidism. And those are things, again, it's subclinical. They don't really, they're test results, but we find it on the biomarker. We see, oh, your thyroid is sluggish, not working properly. You can, and you know what? We even add this on to their medication, and they, oh, now I'm starting to feel better. So, it's well worthwhile.
If you have any questions on this issue, don't be shy. Send us an email. You can do that at info@martinclinic.com.